Welcome back. The DA says 39 cases of assault involving patients were reported at the Bheki Mlangeni Hospital in Soweto since January last year. It says at least 30 were mental health patients who were assaulted by fellow patients. 9 employees were also attacked. The party is calling on government to ensure the safety and well-being of staff and patients. To discuss this further, we are joined by the DA's Jack Bloom. Mr. Jack Bloom, thank you very much for your time on ENCA. Now, at ENCA, we know the story quite well. I think last year the number was at another point, and it was an answer to you in the legislature by the previous health MEC in the province, Bandile Masuku. And the health department said that they put the CEO under precautionary suspension. Do you know anything about what's happened to that CEO at that hospital since then?
Well, in fact, from what I hear, she's still under precautionary suspension. So, in fact, this is another one of the hospitals in Gauteng that doesn't have a permanent CEO. And that hospital, Bheki Mlangeni in Soweto, has been particularly troubled. They've had jobs for pay scams. They've had all sorts of other scandals there, lots of dissatisfaction. And we've had continual promises that psychiatric patients will be put in a specially secure ward, and it hasn't happened. You know, there was a terrible incident last year where another patient was stabbed to death and another one was severely injured by a mentally ill patient. So all the warning signs have been there, and still nothing's been done. I mean, it's just very traumatic for everybody concerned that this particular hospital, especially after Life Esidimeni, when we thought the lessons would have been learned, is still not looking after mentally ill patients as they should be looked after.
Now, you say that she's probably still placed under precautionary suspension. When the health department in Gauteng had an acting MEC in Jacob Mamabolo, he explained to us that the law says that a suspension has to last for 3 months, and once that time lapses, that person who is suspended has full rights to just reassume their position.
Well, in fact, you're quite correct. This suspension has gone on for far too long. We can't have an acting CEO at this hospital or other CEOs for months on end. The problem is there is an investigation which has been languishing at the Premier's office. It was done by a particular company. I've asked for this investigation to be made public, and the Premier has made many promises that these investigations will be made public. He said that this investigation will be made public at the end of this month. Now, I think it's sort of high time that all these reports were made public and acted on. But I suspect that they're very embarrassing for certain people involved. I think they're politically connected people, and they're being protected. But they're being protected at the expense of the lives and welfare of patients at Bheki Mlangeni Hospital, specifically mental health patients. So I really think that firm measures need to be taken soon. Fix up that hospital, put a decent CEO in charge, and make sure that there's a specially dedicated, secure psychiatric ward for psychiatric patients at this hospital. At the moment, they're putting many of them in ordinary wards. And the figures that I got from my latest replies that more than 2,300 mentally ill patients have been at this hospital since January last year. That's an extremely high number, and I think they need to make sure the hospital is able to handle it.
And have they explained to you at all, Mr. Bloom, maybe what it is that they're planning to do to ensure that psychiatric patients don't share the same wards as what we call ordinary patients? I mean, I remember there is an old man who was stabbed to death by a psychiatric patient at that hospital last year.
Well, what they've said now, finally, is that they're going to do 14 beds specifically for male psychiatric patients on the ground floor. They haven't mentioned what they're going to do for female psychiatric patients. But you know, if you're seeing 2,300 patients over a 20-month period, which is the figures they've given me, how are 14 beds going to cope with such a huge number of patients? I think the real problem is they really have not given mental health the priority that it deserves. In fact, many of the patients at this hospital, which is a district hospital, it's a low-level hospital, shouldn't even be at this hospital. They should be at Chris Hani Baragwanath Hospital or a higher-level hospital where they can get the specialist care that they really need. So I think the whole system is wrong. And we need to re-examine how we treat mental patients and make sure that they get the priority they deserve and the care that they deserve for their sake and for everybody else as well in these hospitals.
All right, Jack Bloem, the Shadow MEC for Health in the Gauteng province for the DA, thank you very much for your time. And ENCA did try to get a hold of the Gauteng Health Department, both the spokesperson, Kwarakekana, and the communication manager, Motalatale Mudiba, did not answer any of our calls.